Good evening, everyone. I'm Dr. Michael Dwetzi, RCMA President. Welcome to our all-physician call with our Riverside County Public Health Officer, Dr. Jeffrey Leung. I will now turn over the call to Dr. Leung to give us a COVID-19 update in our county. Thank you, Dr. Leung.
Thank you, Dr. Dwati. So just a short update, and then we can jump into the questions, which I think cover quite a comprehensive, number of elements. So first of all, if people have been watching the COVID numbers, you've seen that they've been creeping up slowly for the past several weeks. And so that goes for the positivity rate, sort of the case rate. The positivity rate at its low point was below 2%. We're now at about 5%. The 7-day case rate in our county was at several hundred before. Now we're getting up towards 2,000 for the past week. So probably the reassuring or the hopeful news is that hospital and ER capacity in general does not seem to be impacted by increasing COVID numbers, at least locally. Although some hospitals have been busier with non-COVID patients. Nationally and worldwide, we are seeing sort of an increase in numbers. So, everyone's watching this closely. And at a state level, they're trying to talk about, what can be done if sort of numbers continue to increase, and whether it might make sense to create some triggers for recommendations at the local level. Not mandates, but just recommendations. In addition to kind of watching the COVID numbers, some of you may have recently seen the FDA alert on Janssen, which essentially says, that if you have mRNA vaccine available, Pfizer or Moderna, you really should be using that first, but that probably for a small subsection of patients. If Pfizer or Moderna is not available, you can still consider using Johnson & Johnson, but that is not a first-line choice because of the blood clot issues that we've seen. And then, a few weeks ago, we did have a cluster of Legionella cases in the desert area. So some of you may have received sort of advisories about that. And the CDC in the state actually also came out and did some testing. And what we found was, the rate of cases is higher than normal, but there was no smoking gun. So there wasn't sort of one exact source or one location that looked like it was causing these cases. So there are many kind of theories on what might have happened, but what we're aiming for is making sure that all of the facilities in the desert areas have good water management and safety plans. And then, this is older news, but I think some of you have heard about, an increase in hepatitis cases, which, may be related to adenovirus. So that's just something to keep on the radar.
For, the first question, just as a reminder, medical offices are still one of the settings in which masks are required statewide. In California, masks are still required indoors at all of your shelters, your cooling centers, your healthcare settings, correctional facilities, and long-term care settings, as well as adult and senior care facilities. Layered upon that, we do have a healthcare worker vaccine requirement that, as you recall, went into effect at the end of September. There was a state public health officer in August, and then that was amended in December and February. But that applies to, all healthcare workers in a spectrum of healthcare facilities, including clinics and doctor offices. And that means that, there's an expectation that healthcare workers receive their booster within 15 days after they become eligible. There are no specific requirements right now for screening in medical offices, whether it's for temperature or for symptoms. That is a little bit different than acute care facilities where all facility letters apply. And then finally, in work settings, there are Cal OSHA requirements. And so that kind of adds a layer of complexity as well. And all of these things, can be taken into consideration for that first question.
Great, thank you, Dr. Leung. So the second question is, what are the current and potential future COVID-19 vaccine booster recommendations for the general population? It appears we'll need a booster every 6 months to keep up immunity. Do any of the vaccines used in other countries have a longer lasting immunity? And do you see any of those vaccines applying for use in America? Is there any progress with Pfizer and Moderna vaccines introducing new formulas that are a better match for current and new variants?
And I'll try to do my best, and others may have, more information. But first of all, the CDC, website is a really good reference for booster recommendations. All those 12 years of age and older can get their first booster. And this is where it starts to get confusing. For the mRNA vaccines, you have to wait at least 5 months after the primary series for that booster. But if someone is moderately or severely immunocompromised, that waiting period is 3 months. And if someone received J&J previously for their primary series, people would have to wait at least 2 months for that booster. For individuals eligible for a second booster, that really includes two groups of people: those aged 50 years and older, as well as those 12 and older with moderate or severe immunocompromising condition. And in general, for the mRNA vaccine for that second booster, we would be waiting at least 4 months after the first booster. For those ages 5 to 11, boosters are not recommended at this time. And then, there's a question about other countries. So Novavax is an example of, a fourth COVID vaccine that has applied for emergency use authorization, and they applied back in January. They're currently approved in Australia, India, and Europe. They use a protein-based technology versus the mRNA technology, and that's more similar to what we use for flu, HPV, and shingles. We really haven't seen data to suggest consistently that vaccines in other countries are more effective or longer lasting. And, really the challenge with looking at kind of better formulas and the future cadence of how often people will need to be vaccinated is that, we tend to see waning protective effects from vaccination starting at about 6 months. And that really depends upon the specific group of individuals. So this is more true in older individuals with lots of medical conditions. Younger folks seem to have protective effects that last longer. But behaviorally, the belief is that it would be really tough to get people, the large and general population, to accept a vaccine on more than a yearly basis. So that's sort of the tension, and you can hear, the FDA and CDC trying to push for a solution where we're looking at a yearly vaccine, but we're not quite there yet.
Great. Thank you, Dr. Leung. So the third question is, what is the status regarding immunizations for young children under 5 years old?
Yeah. So right now it's speculative. The FDA has scheduled proactively several meeting dates in June in anticipation of potential conversations about this topic. Moderna officially submitted an application for emergency use authorization for children 6 years and under. We are waiting for Pfizer, and what we had sort of anecdotally heard was that the 2-dose data from Pfizer in this age group less than 5 years of age was not very convincing. So they're waiting for the data following the 3rd dose, and they're expecting to submit soon. The FDA does not really want to have 2 separate conversations about these 2 different vaccines. So they're hoping that the Pfizer submission will occur soon, and that they can have these meetings about both mRNA vaccines sort of taken together.
Great, thank you. The fourth question is, COVID-19 continues to mutate. What are the current variants of concern that are being tracked?
Mm-hmm. So BA2 is still the main variant that is looking like it that has become sort of the dominant variant. BA2 12.1 is sort of a sublineage that is rising within that category. But for practical purposes, all of the interventions and treatments, are still largely the same. People are watching BA4 and BA5 in South Africa or, outside of the US. And then the California Department of Public Health has a variant tracking dashboard as well that people can look to.
Great, thank you, Dr. Leung. The fifth question is, with COVID-19 becoming an endemic, can we change the SNF policy to isolation of positive patients instead of having the SNFs create a separate red zone? Current policy creates an undue financial and staffing difficulty for SNFs. It also results in patients going back to the ED and hospital when the SNF cannot staff a red zone.
Yeah. So, the short answer is, we would love to be able to see a change, but that would need to happen at both a state and a federal level. And we know that SNFs have really been challenged throughout the entire pandemic. Of course, they were one of the first groups that were hit. And then there's been a lot of support, trying to support testing, as well as vaccination, as well as outbreak management for skilled nursing facilities. But SNFs and congregate settings tend to be a continuing challenge. And really the question, that we keep hearing back when we bring this up on state calls and other calls is, how, if skilled nursing facilities or other congregate settings have positive cases, what do they think is sort of a safe practice as well? And so it's a combination of sort of some requirements as well as what skilled nursing facilities are practically able to do. So I don't have a great answer there, but we know it continues to be a big challenge.
Thank you. So the last prepared question is, with diminished focus on COVID-19, has there been a focused review, assessment, or report of Riverside County Public Health's initial COVID-19 response? What is being done to proactively prepare for the next pandemic or continuing COVID-19 surges? Are there work groups, guidelines, protocols, communications, PPE, et cetera?
So this is a great question. So, and it's very timely because, the county is about to actually embark on sort of a review of the COVID-19 response. And that will look at, everything from emergency management department, sort of the response from fire, who really helped with a lot of the structuring. And then, we'll look at the impact and the efficacy of sort of the county and all of the partners sort of taken together. We do expect an after action report coming from this review, probably towards the end of the summer. And I'm sure that will be publicly available. In terms of proactively preparing for the future, the pandemic, has probably, given us much more experience. So the structures and teams, even a lot of the software and technical capabilities that, we've built up for the pandemic actually, are helping us going forward with even other types of outbreak management. So, if there's any silver lining, probably our county as well as other counties are much better positioned in terms of surveillance, monitoring, and outbreak response for both future COVID surges as well as non-COVID episodes.
So I think we'll go ahead and close. Thank you all for attending, and Dr. Leung, thank you so much for the update. I hope everyone has a fantastic evening.